So next we would like to hear from Clara Meehan. Clara Meehan is the Health and Social Care Lead with the Project Transition Team in the Mental Health Services in Roscommon. Her role on the team is to represent the occupational therapists, the social workers, the psychologists within the service. Clara has also lived experience of recovery as a family member and has completed training in WRAP, co-production and skill building for mental health engagement through the CAWT Recovery College and Mental Health Ireland and the HSC. Clara is going to share the process of the co-produced engagement project that she's developed in Cathal, Kilcline, and Cathal is a service user representative with the Project Transition Team within the Mental Health Services in Roscommon, and Cathal's role is to represent service users and family members in the service. He brings his own lived experience of recovery and mental health services to his role. Cathal has collaborated with Clara on this project focused on evaluation of the service through service user and family member engagement. Unfortunately, Cathal is not able to join us today. However, we are delighted to welcome Clara to share their experience. So, Ms. Clara. Do you want to start? All right.
Yeah. So thank you, Pamela, for the introduction. And just as Pamela mentioned that Cathal Kilcline, our service user representative, can't be here to co-present with me today. But I just want to acknowledge the amount of work that Cathal put into this project and also his contribution to this presentation as well. So just to go through, I suppose, our agenda for today. So I'm going to go through the history of the project of service user family member engagement in Roscommon, a bit about co-production and practice, service user family member engagement that we did in Roscommon, the key findings of that service user family member engagement, the current status and outcome of the project, and what we feel future engagement should look like. So just to take you a little bit of a background through the history of the project. So the Roscommon report was published in 2017, and this was an external review commissioned by the HSC. And it set out 27 recommendations for service improvement and development. A project team was set up in November 2020 and was tasked with implementing the recommendations of the Roscommon report. The project team comprised of a project lead, clinical director, director of nursing, nurse practice development coordinator, service user representative, and health and social care lead. Recommendation 23 in particular highlighted the need for greater consultation with service users and family members. And myself as the health and social care lead and Cathal as our service user rep took responsibility for the scoping, planning and implementation of this recommendation. So what was recommendation 23 of the report? So it said that consultation with patients and families should be given a higher priority. The service should take cognizance of the distinct roles that each has to play in the continuity of care, the provision of safe and effective care, and service development. So our approach to recommendation 23 was we agreed for the need for direct engagement with service users, family members in order to address this recommendation. We developed a work plan in line with the quality framework in mental health, and we designed co-produced questionnaires, and these were co-produced between service providers, service users and their family members and supporters. And these were specific to each service area or group, i.e. community mental health team, training centres, acute unit, and one specifically for family members. A pilot of the questionnaire was conducted within the day centres in 4 areas in Roscommon. So we needed to build support for participation through collaboration with service users, family members, and service providers, and this was key. Consideration was given to various modes of engagement in order to maximise participation, and bearing in mind that we did this really when there was a lot of restrictions with COVID. So, for example, we used interview, either face-to-face or telephone, completion of a paper version of the questionnaire, and also an electronic version of the survey. So, I suppose the key theme really was co-production. And I suppose just to go through a brief definition of, I suppose, what co-production is. So co-production requires a stakeholder in a project or enterprise to work together to achieve their desired outcome. Co-production in practice requires each stakeholder to understand and offer the distinctive contribution that they bring to the process. So how did we co-produce our project? So we had meetings with all of the key stakeholders in advance and throughout the project. We connected with the service user representatives working in the service regarding the questionnaire and also the proposed engagement with service users and family members. So, for example, we connected with the peer support workers and the service user representatives within the organisation. So we had service user representatives working on the clinical service advisory group and also on the steering group. We engaged with the family peer support worker and social worker who assisted in the design and implementation of the questionnaire with family members. We also had meetings with service providers, nursing, medical, health and social care professionals, the training centre manager and staff. And I suppose these meetings were on one-to-one, but also in teams as well. We also connected with the peer advocate based in the acute unit, and we had engagement with the area lead for mental health engagement and recovery throughout the process, really from the start and now at the implementation phase that we're at now. And I suppose there was also a co-produced nursing strategy that was developed prior to our engagement. So there was huge learning for us in the process that was involved with the development of this strategy. So just, I suppose, myself and Cathal, when we were preparing this presentation for today, we were reflecting really on the process of co-production and our experience of producing this project. So I suppose the first thing, and this was something that Cathal said, well, it was really about teamwork, but it was about not just working with the multidisciplinary team, but working with everyone, service users, family members and their supporters. And I suppose it fostered working together as a team and inclusive of everyone. It also was about building relationships. So building relationships between all the key stakeholders, service users, family members and service providers. And this was fundamental to success. Then the third piece we came up with was the value really of lived experience. I suppose Cathal, as a service user, had great insight and experience of the mental health services in Roscommon, and this was invaluable in how we approached the engagement. I also have my own lived experience of recovery as a family member, as well as my own clinical knowledge as an occupational therapist. I suppose there was great synergy, really that combined effect of the lived experience and clinical knowledge, and this was very powerful and also made our project very authentic. There was also great partnership, and it was very much an equal partnership between all of the key stakeholders. There was great learning from each other in, I suppose, Cathal's lived experience, my own lived experience of recovery as a family member, and also my own clinical background as well. There were certain things, I suppose, as my own background was as an occupational therapist, so I had an understanding of maybe the environment and what challenges that might be there in terms of engagement. Cathal was great at picking up on some practical things in advance and throughout the process that were really helpful. There was also times when I needed to know when I had to step back, particularly when we engaged within the acute unit. Service users were much more comfortable with Cathal leading out as a service user. So there was that really, I suppose, knowing when to step back and also draw on each other's experience. I suppose there was huge commitment to the process of engagement from the start because we had used this process of co-production where everyone's voice was equal. And there was huge organisational commitment as well. There had been extensive training done within Roscommon in recovery principles and practice, so staff had a really good understanding of co-production and what we were doing. And I suppose all of this really has led to the development of a strategic plan, which we have, I suppose, just shared with our area management team and head of service. And this is a plan really where we've taken the feedback from service users and family members and implemented it into a plan for service improvement and development. So I suppose just a breakdown of who we engaged with. So we had 134 service users and family members who engaged with us. 61% were from the community mental health team, and that was inclusive of the Recovery College as well, Regari. 22% were from the training centres, 9% were from the acute unit, and 8% were family members. So just some quotes of what our service users and family members said. There needs to be more counselling. I'm on a waiting list for 3 years. Normalising my illness gave me the power to get well. And just one at the bottom there from family member. Keeping patient privacy in mind, giving as much information to the family on the patient's progress, or at least what we need to change in caregiving so that they get better, would be helpful. Not all patients discuss their illness with their family. So where are we at now with the project? So the data collection analysis has been completed. We have key findings and themes that have been identified, and we've developed a strategic plan with a 3-year timescale aligned to sharing the vision. We've clear identified actions identified for years 1, 2 and 3, and this strategic plan, as I said, has been presented to the project team and also the area management team and head of service. And this feedback from the service users and family members is to be integrated into the local 3-year strategy for the service, which is fantastic. So just to show you, I suppose, the 8 key themes that came from our service user family member engagement. The first one there is the need for greater family support and engagement, particularly the important role of the family peer support was highlighted here. We have a part-time family peer, but this needs to be a full-time role. There's also a need for greater education, I suppose, in terms of supporting family members. And also service users kind of highlighted the need for a designated social worker also in the acute unit. The second theme was the need for more therapies and supports, and this was inclusive also of some specialist interventions, particularly around ADHD, ADD. So I suppose the therapies that people mentioned were occupational therapy, social worker, psychology, peer support, and counselling. Were the therapies that people said they needed more of. And we are doing an audit of therapeutic services and supports, which will be done by the end of this year, to look at where the gaps are and then put a plan to implement changes. Also, the information on accessing the mental health services. So people said that when they were in the service, the information was quite good, but it was actually getting information on how to access the service in the first place was the biggest challenge. So we are working on the development of a platform through West Be Well with all of the key information up there, and that will be linked to the national website. Also, the development of a crisis pathway service, which is easier for service users and family members to access. So service users and family members said that they actually knew what to do in a crisis, but the biggest challenge was that I suppose they felt that there should be a better way. So really what we need is a designated, I suppose, mental health assessment unit that's fully resourced. So then the fifth theme was the need for a new acute unit with expansion of existing bed capacity to meet demand. So that's what people said to us, that sometimes when they needed to go into the acute unit, that the bed availability was a big challenge. And I know that's a challenge for staff as well. Then embedding the qualities that are required by mental health care professionals working in the mental health services. So we specifically asked the question to service users and family members, what qualities should staff working in mental health have? So they mentioned the first biggest one, I suppose, was communication skills, in particular listening, empathy, kindness and compassion, and also knowledge. So we're looking at ways we can do some training and integrating this to our team building. So values and action, and also the team recovery implementation plan are 2 particular tools that we're looking at rolling out. The development also of an electronic service user passport. So this is something that has been developed through the local forum, and I know is being piloted at the moment in CHO1. So it'll be something that we'd like to see happening and also in CHO2. And the last theme then was sharing good practice in addition to service improvements within the training centres and day centres. So there's a review of the training centres and day centres in Roscommon, and we're very much working with the project lead to share the feedback from service users and family members in relation to the training centres as well. So I suppose what should future engagement look like? We have an audit committee in Roscommon, and we did an audit of clinical records last year. But for the one that's going to happen next year, we're going to look at also having to see if there's any evidence of service user family member consultation in terms of the care plan, that will actually come in as part of that audit. Also, service improvement initiatives. Cathal, as our service user representative, is involved in a lot of service improvement initiatives, which is fantastic. Some of these are like the safe wards. They're also the planning group around a new acute unit in Roscommon, and he's also a director of the melting pot in Roscommon as well. Also just informal conversations. So it's not just, I suppose, the formal process that we have done using the questionnaire, but I think having those informal conversations all the time with service users and family members. Myself and Cathal are always touching base with people through our work. I think what we've done should be really an annual survey of engagement with service users and family members. And also, obviously, the value of the forums, the local, the area, and this national forum as well. I think there's huge value in getting feedback through the forums as well. And I suppose what's really important to the whole process is organisational commitment. And I suppose what's important too is that service users are represented at every level of the organisation. So I'd just like to say thank you for listening, and just thank you to everyone who has contributed, all the staff, managers, individuals who avail of our service, and their family members and supporters who actively engage with us to complete this recommendation. Thank you for listening.